Nowadays, there are about 131 studies analyzing the effectiveness of vitamin C in treating various myoplasias. But always, as I always say, combination with other drugs. A study has recently been published combining gemcitabine and vitamin C for the treatment of pancreatic cancer. It has been shown that vitamin C doubles the life expectancy of pancreatic cancer patients when combined with vitamin B. The conclusion of the article is that vitamin C sensitizes pancreatic cancer tumor cells to the action of gemcitabine. But wait, where's the part in the study where it's only treated with vitamin C? Well, it doesn't exist, and this study was published very recently. It could be the other way around. Maybe gemcitabine sensitizes vitamin C. Perhaps vitamin C on its own would work better. Well, we don't know this because this study has been done, but it hasn't been published. So, when I started studying vitamin C and cancer, I wanted to know, I already knew that yes, it works. It works. But how does it work? And where do we attack? Where do we start? About 4 or 5 years ago, Dr. Rosalie David from the University of Manchester did a fascinating study with Egyptian mummies. Notice that we've known about cancer since the time of ancient Egypt. There's a papyrus called the Edwin Smith Papyrus, which is kept in the New York Medical Museum, where 8 cases of breast cancer are documented. This papyrus is from the 17th dynasty, but it's supposed to be a copy of an earlier papyrus from the 4th dynasty. And it's a real medical treatise that talks about the use of opioids to manage pain, where carotid massage is recommended to lower blood pressure. We're talking about, if it's from the 4th dynasty, we're looking at 2500 BC. This is impressive. This papyrus is attributed to the very god Thoth. Just to give you an idea, it describes cancer, and it seems that the ancient Egyptians treated cancer. A tool that we don't know what it is was called a burning drill. So, Rosalie David, while doing a study with Egyptian mummies, looked at 200 mummies aged between 20 and 60. She tried to find remains or signs of vascular diseases and cancer, and she saw that in terms of vascular diseases, the Egyptians had roughly the same number of pathologies as we do, with a similar frequency, maybe a bit lower, but similar. In cancer, she only found remains in one of the mummies, prostate cancer. And of course, this surprised her. That is to say, if in the same age range, cardiovascular or vascular diseases were similar, but cancer is much lower, she concluded that there's nothing in nature that can cause cancer. Cancer is a disease caused by changes in our lifestyle, in our diet, and sustained stress. This was published in the journal Nature in 2012. So, it's not nonsense at all what Rosalie David is telling us. What she's saying is that cancer is a product or a consequence of metabolic changes in the body. That's why we focused a bit on the metabolism of normal cells and the metabolism of tumor cells to see if that was where the effect of vitamin C could be. If that was exactly the key that was modulating vitamin C, look, the Warburg effect is the classic metabolism of tumor cells. 85% of the tumors we know today have a Warburg metabolism. Interestingly, despite being so important, this isn't studied right now in medical schools. It's not studied at the Jiménez Díaz Foundation. I've given talks about the Warburg effect, highly recognized pathologists. How is it possible that something so common in tumor cells isn't studied in medical school and has been left out of the current curriculum? It's surprising. What is the Warburg metabolism? Look, in 1931, this gentleman you see here, Otto Warburg. Not to be confused with Otto H. With Otto, this is Otto Heinrich Warburg. Not to be confused with Otto Warburg, the banker from the Federal Reserve. This scientist received the Nobel Prize for the discovery of what he called the respiratory enzyme and the metabolism of tumors. He concluded. Look, this is a publication in the journal Science from even earlier, one of the tumors from the 1900s. He concluded that normal cells have an absolute dependence on oxygen. Absolute. Tumor cells can thrive without oxygen, but this rule has no exceptions. And also, cancerous tissues are acidic, while healthy tissues are alkaline. We see this in the pathology department every day when we're staining tumors and normal tissues. we see that they stain differently and that the adherence, the fixation of the dyes, the fluorescent markers, and the immunohistochemical markers is different because the pH of the tissue is different. So, well, Otto Warburg already described this, and that's why he was awarded the Nobel Prize. So, in other words, cancer has a different metabolism than normal cells. What is cellular respiration? What was he working on? What was Otto Warburg, let's say, investigating? Well, respiration is simply the process by which the cell obtains energy. And in a normal cell, this process has three parts: glycolysis, the transformation of glucose into a molecule called pyruvate, and the Krebs cycle. In the Krebs cycle, this happens outside the mitochondria, the Krebs cycle. Once inside the mitochondria, pyruvate is converted to oxaloacetate, and from there, there's a series of reactions, again, anabolic and catabolic, that can produce, I'm not going to have time in 5 minutes, but I'll try not to go on too long. They will produce NAD, NADH, and especially ATP and electrons that will be transferred to the respiratory chain. Here, these electrons will be transferred to oxygen, resulting in the production of ATP, energy for the cell. That's how we function. But look, the normal differentiated tissue, what's happening? About 85% of the energy is, let's say, obtained through oxidative phosphorylation. In other words, glucose is transformed into pyruvate, then the Krebs cycle, the respiratory chain, and ATP is produced. Notice about 36 molecules of ATP per molecule of glucose. But when there's no oxygen, the metabolism changes. Glucose is converted into pyruvate, and outside the mitochondria, it's transformed into lactate. Fermentation, a very inefficient process. Only 2 molecules of ATP for each molecule of glucose. In a, let's say, proliferative tissue, in the stem cells of each tissue or in tumors, what happens is that 85% of the energy is produced by fermentation. Glucose goes directly to lactate, even in the presence of oxygen. This is very inefficient. Notice only 4 molecules of ATP per molecule of glucose. So we need to ask ourselves a question. The question is, why does cancer thrive? Why is it so successful when it's very inefficient at the energy level? What have we said? Notice, what happens in the tumor is that glucose is fermented into lactate. That lactic acid is expelled outside the cell to the environment. The environment of the cell becomes acidic. There are many protons. What happens when oxygen comes into the cell is that it meets those protons and the water is formed. So that water is precisely what causes the characteristic swelling of tumors, the oncos. The oncos, that's where oncology comes from. Remember, this term was coined by Galen, the physician of Marcus Aurelius, the emperor from Gladiator. Oncology, that's where this swelling comes from. Notice how important the Warburg metabolism is, as this is, let's say, the central basis of PET. In PET, what we do is inject a patient with labeled glucose, and where it accumulates, we can see not only the location of the tumor, but also its size, with millimeter precision. We can even see if there's a production of new blood vessels. Why does this happen? Because all tumors, or 85% of tumors, have this craving for glucose. In other words, notice why this is important. Robert Weinberg, nominated for the Nobel Prize, more than 10 times, for the chain of mutations in colorectal cancer, says that cancer is primarily a genetic disease. What I'm saying here is that what we're seeing in this test is that regardless of the tumor and the genetic background, 85% of tumors have a craving for glucose. So I think that cancer is more of a metabolic disease, regardless of the genetic background of that disease.